All right, to all who are new here, welcome to Relevate Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar, or you can sign up for the email list to be notified of upcoming webinars. We are continuing to update our upcoming schedule, so check back often. For all athletic trainers, we're intending to get live continuing education units from the BOC. You will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other questions or concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The PowerPoint for today's talk is available for download from the dashboard. The recording will be available for review from our website tomorrow. Our speaker this evening is Dr. Raphi Wald. He completed his bachelor's at Yeshiva University in New York and received his Doctor of Psychology and Master of Arts in Clinical Practices in Psychology at the University of Hartford in Connecticut. He currently serves as the team psychologist and mental skills coach at Florida Atlantic University and Lynn University, where he provides performance enhancement and restoration services to male and female athletes, psychological services to athletes with depression, anxiety, and eating disorders, and he does screening in the post-concussion setting. He also serves as a psychological examiner for the Chicago Cubs, where he interprets psychological profiles and grades prospects. He has had many publications, including the 7 Practices of Mentally Superior Athletes. He will be speaking today about mental health in the college athletic setting. And so I am going to go ahead and change the presenter back to him so that you are able to see his slides.
All right. Can you hear me okay?
Oh yeah, looks good.
Okay, great, excellent. Now I just need to make this, let me just minimize this here. Okay, great, excellent. Thanks so much, everyone. I am gonna try to leave some time towards the end so that we have enough time for everybody to ask questions. Just having a little bit of an issue putting this in presentation mode. That's the only problem I'm running into. There we go.
There we go.
Okay, great. So, I'm sorry, I'm still just having technical difficulty here. Okay. Okay. I'm going to apologize. I may just have to do it from this setting here, if that's okay with everyone. Can you see the full slide? Are you able to see the full slide when I do it this way?
Yes.
Okay, great. Again, my name is Dr. Raphi Wald. Thanks so much for having me here. The name of this presentation is Mental Health in the College Athletic Settings, how to make sure your athletes get the best care. I know that this has been a huge topic of discussion for everybody as we're going through this coronavirus issue. We have here at FAU, we've seen, just like everywhere else, we've seen a lot of student athletes that are struggling. I want to talk a little bit about just how to make sure that your student athletes are getting what they need. I don't have any conflicts of interest to discuss. Again, my name is Raphi Wald. I am a licensed psychologist. I am a certified mental performance consultant, and I am board certified in clinical neuropsychology. I work as the team psychologist for Florida Atlantic University and Lynn University. Moving on to our next slide. So before I get into this, some of these issues, I just want to talk to you a little bit about what it means to become a licensed psychologist. In order to become a licensed psychologist, a person needs to go through, usually it's 3 or 4 years of training in clinical psychology. You take 1 year of almost all classes, and then you do basically part-time classes, and then part-time you're working in a clinical psychology setting. You're being supervised by another clinical psychologist. It's a very long and involved process. So beyond just those 3 to 4 years of coursework and 3 years of supervised experience, then afterwards you go on and have a full year of what's called pre-doctoral internship, where you are working full-time and you're supervised, and then there's at least 1 more year of postdoc. I did 2 years of postdoc in neuropsychology, and then I did another fellowship in sports psychology. So it's a very involved process. The reason that I am explaining this all is just because I want you to understand who is helping your student athletes. So clinical psychologists are people that have an extensive amount of training in human behavior, in evaluating human behavior, in tests and measurements. That is to separate them from a social worker or a licensed mental health counselor who also has expertise in mental health problems, but to a lesser extent, they have lesser training, and also to differentiate them from psychiatrists, who are physicians who go to medical school just like any other physician, but they specialize in the medical management using medication to treat psychological problems. There are psychiatrists that do psychotherapy. Most psychiatrists do not do that form of a talk therapy, and they focus most of their work on prescribing the right medications in order to help people with psychological issues. Moving on to this next issue. So in truth, the field of sports psychology is relatively young. There's not one right way to do things. There's the Association for Applied Sports Psychology, is basically the governing body of sports psychology. They're the organization that provides that credential that I was talking to you about earlier, the Certified Mental Performance Consultant certification. But they don't come out and say, you know, in an NCAA Division I setting or in a high school setting, this is the way that your mental health system should be set up. They don't come out and say there's one right way to do things and everything else is the wrong way, which is why when you go from one university or one high school to another, you're going to see a lot of different setups. The underlying most important part of any of these situations is that there is excellent communication between the psychologist or social worker or psychiatrist that's working as the team mental health specialist and the athletic trainers. That relationship is absolutely crucial. The train absolutely cannot run without really good, strong communication between the mental health professional and the athletic trainers. I've had really, really good fortune in working with Florida Atlantic University and Lynn University to have awesome athletic trainers. Unfortunately, there's a lot of trainees that come through, a lot of interns and graduate assistants that have come through. So, you know, I establish a strong relationship and then they go on and sort of start from scratch. But thankfully, I've had to lean on them a lot over the years, and I feel like they've had to lean on me a lot, but we really get the job done very well together. As I was saying, I can't, as a team psychologist, I can't do my job without the help of the athletic trainers. So for example, at Florida Atlantic University, we have over 500 student athletes. It's just impossible for me to be monitoring over 500 student athletes at all times, especially when at FAU now what we have this year for the first time is we have our football team, which makes up almost 20% of my student athlete body. They're almost on the other side of campus, and my office is in the other athletics complex where most of the other sports work out of. So it's really just completely impossible for me to do my job without relying on the athletic trainers. The athletic trainers, for me, to an extent, are the eyes and ears on the ground. So I have ongoing discussions with my athletic trainers just in terms of what it is that I want them to be looking out for, what it is that I would be concerned about, how to recognize potential problems with depression or anxiety, when they should be coming to me. And I leave if I'm not with a student athlete, I try my best to always leave my door open so that athletic trainers can just walk into my office and say, hey, doc, here's what's going on. I've got this swimmer and I'm seeing, they're showing up late every day, and I know that they just broke up with their boyfriend, and I'm sort of concerned. That way we can have an open discussion about what the next best steps would be. And to take that a step further, I think that's why it's just so crucial in my personal experience. It's just so important for the team psychologist to have their office on site, preferably right off of the athletic training room. Obviously, there has to be privacy, and you can't have an office with windows that open up into the athletic training room. But I really just feel very strongly that having a team psychologist that's housed on the other side of campus in a counseling center is not an ideal setup. Really, in the athletic training room is important. Just to take it a step further, I think what's important is for the student athletes that don't already meet with the team psychologist to just see that person around, know that they're not kind of like the Wizard of Oz that's hiding behind a curtain and pulling strings, so that they can just see that that's a normal person. There's a lot of student athletes that I don't necessarily see formally in my office for sessions, but that will just come over to me and say, hey, doc, I've been having a hard time hitting. I was wondering if you can help me. Here's what's going on, or just to catch up and tell me what's going on with their lives. So I think that ongoing relationship is really, really important. Okay, just as I was saying, again, really important for student athletes to see the team psychologist so that they feel more comfortable around them. When I first started at FAU, which was over 8 years ago, or which was about 8 years ago, the then head athletic trainer, John Burnside, and I were talking, we were really concerned just that student athletes were going to be really shy and nervous to see a psychologist that was housed right off of the athletic training room. And, we went into it with kind of a let's take it as it comes attitude. We'll evaluate it on the fly. And as it turned out, it really was not an issue. Student athletes, thankfully, in my experience, have really not been embarrassed on the whole to come into my office. In the rare instances when that does happen, when there's someone that's very sensitive about it, there are ways for us to set up a meeting upstairs or in a different area of the building so that nobody knows about it, so that it's more, so that nobody sees them walking into my office. Thankfully, we're in an era where it's becoming more and more acceptable for people to seek psychological help. Definitely, we're not living in a time when having depression is seen as the same as having diabetes or having epilepsy, but thankfully, we've definitely come a long way. We definitely, in my opinion, though, have a very long way to go to that end. Okay. All right. Again, just to review some of what I was saying before, just so that you see it written out. Again, a licensed psychologist is a person who's undergone years of training in coursework and supervision, has undergone predoctoral and postdoctoral training in human behavior in order to do formal testing and psychotherapy. that is a licensed psychologist. Going back earlier to what I was saying before is that the field of sports psychology it's a very, very young field. Things are not hammered out as clearly necessarily as hopefully they will be someday. So I think it's important for you as athletic trainers to understand what kind of a professional you're dealing with and what kind of a professional you need for different sorts of situations. I want you to think of a continuum, okay? So on the entire continuum can fall under the broad category of sports psychology or sports psychologist, okay? At one very far end of the spectrum, you have what's called a mental skills coach. So this is a person typically that will have a master's degree or PhD specifically in sports psychology. That is a person that takes courses and undergoes training in order to help individuals learn skills like imagery, visualization, how to build their confidence, how to sustain mental energy over the course of a long season. That's something that I talk about a lot. Team building, all those sorts of things. So that really is what the mental skills or pure sports psychologist is trained in. That person is not trained to treat mental illness. That person is trained to work on performance issues. Again, whether they're sports related, working in the fine arts, like with theater, dancers, even NASCAR, that sort of thing, that's what that person focuses on. On the other far end of the spectrum, you have a licensed clinical psychologist who is a person who is trained to treat mental illness and to help people with mental health problems. On their own, unless they go out of their way and seek it out, a clinical psychologist does not have a specific training to work with athletes. It doesn't necessarily mean that they're not capable of it, but they don't automatically get experience in working with athletes, okay? But now if we come back to my continuum again, on the one hand, we have the mental skills coach. On the other hand, you can have the clinical sports psychologist. The clinical sports psychologist is a clinical psychologist that has specifically undergone training in treating mental health problems in athletes, okay? That person does not necessarily have training in mental skills, so they don't necessarily do a great job with, again, focus, different forms of attention, what we call internal and external attention, broad or narrow focus, those sorts of things. They don't have that sort of a training, but they do know how to work with athletes in dealing with mental health problems. So, in between those two far ends of the spectrum within sports psychology, there's really everything in between, right? So you have people that have more experience one way, more experience the other. Me personally, it was very important to me that if I was going to work in this field for an athletics department to rely on me, it was important for me to get all ends of the spectrum. So I am a licensed clinical psychologist. I do have a lot of training and experience in working with athletes on mental health problems, but I also underwent that CMPC certification, which focuses itself on the mental skills that I was talking about. It is important to me to be able to do that. But for you as athletic trainers, I want you to know who you're working with. I want you to know what they're qualified to do. Theoretically, again, if you're working with a mental skills coach who is not a clinical psychologist, if they're talking to one of your student athletes and the student athlete says, hey man, I've really noticed that I haven't been sleeping well lately and my appetite hasn't been good. If that mental skills coach is operating ethically, they will stop and they will refer that person to the clinical psychologist rather than trying to treat those symptoms of depression, which they're not trained to deal with. Okay. Again, just going over what I said earlier, the licensed psychologist has complete, if you have a licensed psychologist, it's really valuable to have that person also have completed coursework in mental skills. So for me, as I was saying earlier, once I was done with my doctorate in clinical psychology, I then had to go back and do more coursework specifically in the areas of mental skills. So that includes things like kinesiology and sports psychology theories, working with athletes in different sports, all those sorts of things. So I did have to do a lot more coursework. So there definitely is a lot of training if a person wants to get all of that experience that's necessary to cover the entire spectrum. Okay. Now let's talk about causes of burnout and mental illness in student athletes. Right now, I think that just to add on to what you're seeing on this screen right now, all of these things are really, really important. All of these things lead to a huge amount of burnout in student athletes. By definition, as a student athlete, you just have no control over your life. You are programmed from the second you wake up to the second you go to sleep. And you guys know this, you see it every day. So, you're waking up in the morning and you immediately have to get to the pool. You go, you change, you're in the pool. You are grinding hard for 2.5 hours. Then you're out of the pool and you're going to lift. You lift, and then you maybe have a chance to, run to the cafeteria, or if not, you're grabbing an energy bar out of your bag, and then you're going to your classes. And then you have study hall, and then you have other work you need to get done, and then you might have another practice in the afternoon, and then it's time to go to sleep and repeat and do the whole thing over and over and over again. People in general really do need to feel like they wield some sort of control over their lives. Not having any control and being at the mercy of your professors and your coaches is a recipe for mental health problems, for people feeling like they have no control. Just know that and keep an eye on it, and just understand that that is something that is going to cause burnout in a lot of your student athletes. Physical exhaustion. Again, if they're not burning themselves out physically, they're burning themselves out mentally, because they just played a football game, their body is completely beat up, they had to fly home on a 4-hour flight, sore, in pain, with ice packs on, and the second they get home, they have to cram for a test that they have on Monday morning. Sexual assault, unfortunately, is a major issue on all college campuses. Certainly, student athletes are not immune. By no means are they, and it creates a huge amount of burnout in student athletes. A lot of this none of this has changed since the coronavirus began. Rather, it's all still there, it's just amplified. So in the past, when I used to see a student athlete who is having an issue with a breakup, which is, having a first real breakup, that's a huge issue that I see very, very frequently, that leads to a lot of depression. But in the past where I used to see it, it just seems like, in my experience over the past 6-7 months, what's happened is all the same problems are there, they're just more severe. Nothing to that end has changed in terms of the stressors, it's just there's more of it, and it's more severe. Again, as I was saying, breakups, illnesses in the family are a really important issue that I also want to touch on. For example, we're here in Boca Raton, Florida, so I have a student athlete, for example, who is from Wisconsin, and God forbid, mom just got diagnosed with cancer. Well, all they're getting from their family very frequently is, it's going to be okay, it's going to be okay. All they really want to know is, how serious is this situation? All they're getting from their family is the family trying to protect them from how serious what's going on is. It's a very, very difficult thing to have someone in your family sick and to be so far away, and just have your family continue to tell you, what you need to do now is just keep playing baseball or keep playing softball and focus on yourself. We're going to be fine. It's a very difficult thing. Deaths in the family are extremely, extremely taxing. This is something, again, that is no different from the way that it used to be, but it is just amplified because you have student athletes that have someone in the family die, like an aunt or an uncle, and they just can't attend the funeral because of COVID. So that dynamic it's just as bad as ever, but it has this whole new complicated dynamic to it. Also, just generally feeling like you're not there for your family. You have a little brother who all of a sudden is getting into trouble at school. He needs guidance. He's rebelling. He's not listening to his parents. He's mouthing off. And you just want to be there to help and mentor them. And you just can't. You just can't get your hands around the situation because you're 1,500 miles away from it. All of these are major causes of burnout among student athletes. Okay. Signs and symptoms of mental illness. Let's talk first about depression. In order for a person, technically speaking, to meet criteria for having major depressive disorder, again, by definition, they must have a few of the following problems. They have to have them more days than not for at least 2 weeks. So that means at least 8 out of 14 days. And again, the technicality of all this should not matter too much to you. What's most important is that you generally recognize signs. Symptoms of depression, again, more days than not for at least 14 days. There has to be depressed mood. There's a lot of debate out there about what depressed mood is. There's a lot of research on it. Basically, depressed mood means you are just plain old not happy. There are people say that it's an absence of feeling. There's a lot of different ways to look at it, but I think the easiest and best way to define it is to just say that person is just really unhappy. Anhedonia means you have a hard time enjoying things that you normally would enjoy. Under normal circumstances, you would enjoy going with your buddies to the movies. If the girls are going out to get something to eat, but you just don't want to do it because you know you're going to have a horrible time. Feelings of guilt, especially about things that are not your fault. Again, feeling guilty about someone at home being sick and you not being able to do anything about it. Poor appetite, that's typically speaking, with atypical depression, sometimes people eat everything in sight, but much, much more typically, poor appetite is the issue that people face, which again, now you add in the student athlete dynamic to it, and it gets very complicated, okay? Because you have an endurance athlete who, generally speaking, is relatively underweight, and then all of a sudden, they're burning 4,000 calories a day, and then all of a sudden they go from taking in 4,000 calories a day to taking in 1,500 calories a day, and you've got a serious problem on your hands. This is one of the ways that depression really wreaks havoc on people within a student athlete, within an athletics department. Insomnia, obvious as a student athlete, that can destroy performance. It's really, really hard to want to get out of bed and go into the pool when you've had broken sleep over the course of 2 hours, poor concentration, and suicidality. So these are the signs of the symptoms of depression. These are the things that you're going to want to be looking for and discussing with your mental health professional. Depression, I see all the time. I would say even more frequent than depression, I see anxiety. By definition, what anxiety is excessive worry. Anxiety means that you are worrying more than you should, given what's going on in your life. That's really the definition between stress and anxiety. So if you have a senior on your lacrosse team who has been one of the best players on the team, has been a model student athlete, and all of a sudden they're panicking because that they're going to get cut from the team or they're going to lose their scholarship because they failed one quiz, that's anxiety, right? If you have a freshman who is worrying themselves, they're worrying a ton because they're failing every single one of their classes and they're sort of feeling like they're realizing they're not good enough to be on that team. and they're about to lose their scholarship, that's an appropriate stress level given the situation. It doesn't necessarily make it any easier, but that is a serious situation that they need to figure out. But again, anxiety by definition, it's excessive worry. You're worrying more than you need to given what's going on in your life. The most common form of anxiety, and anxiety can pop up in a lot of different forms. I'm going to speak about a few. The most common of which is generalized anxiety, which is, it just means you worry. You worry about stuff. You worry about finances. You worry about your boyfriend or your girlfriend. You worry about your parents at home. You worry about your sport. You worry about your grades. You name it. That is what it is. You worry about things more than you need to, given what's going on. Then there's panic attacks. Panic attacks, another form of anxiety that pops up in some people. And essentially what a panic attack is physiologically is the fight or flight response gone awry. So if you are walking down the street and you almost get hit by a bus, your body's going to go into fight or flight mode. Your heart is going to start pounding. You're going to be short of breath. You're going to have this feeling of impending doom. All of these are things that happen to people when they have panic attacks. So essentially, a panic attack is your body thinking that your life is in danger when it actually is not. And treatments for all of these things are definitely a discussion that we'd have to save for another day, just in the interest of time. But moving along, okay. The Diagnostic and Statistical Manual of Mental Disorders. We are currently, which is basically the big book of psychiatric illnesses. There are over 300 of them now. We are now on the 5th edition of the DSM-5. Up until the DSM-4, obsessive compulsive disorder used to be considered an anxiety disorder. It is no longer considered an anxiety disorder because really the reason is because new research indicates that it doesn't necessarily line up as cleanly with anxiety as we thought it once did, but it has a lot of the same features of anxiety. OCD, what it is by definition, it consists of obsessions and compulsions. Okay, obsessions means that you have a thought, any kind of thought in your head, and you just cannot get rid of it. It can be something logical, it can be completely illogical. So for example, it might be that if you don't check your alarm 15 times exactly, and this really happens, I know it sounds like I'm exaggerating, but if you don't check your alarm exactly 15 times before you go to sleep and spend at least 45 minutes checking them altogether, that you will not wake up on time for practice. Okay? They can be sort of more illogical. They can be, for example, okay, I know that if I tap on this desk 100 times, that I'm going to play really well tomorrow. And I know it's probably going to take me 25 minutes to tap on the desk perfectly that many times, but I'm going to do it. And you start tapping, okay? Actually, what I just leaked into, I apologize, I just leaked over a little bit into the compulsion side of things. The obsession side of that would be that you're not going to play well unless you take some kind of an action. A compulsion, by definition, is something that you do in order to make yourself feel better about the obsession. Okay? So your obsession is, going back to the alarm setting thing, and I apologize for skipping ahead to the compulsion side of things. The obsession within that is that you worry that you are not going to wake up on time for practice tomorrow and that you're going to get kicked off the team. And you worry and worry about it, and you can't stop thinking about it. So what do you do in response to it? You develop a compulsion, which is that you check your alarm for 45 minutes every single night. With the other example, what is your worry? Your worry is that you're not going to play well, something you can't get out of your head. And what do you do in order to make yourself feel better about it? It's something illogical, but you tap on the desk over and over and over again. That basically is, in a very brief nutshell, that's what OCD is. Getting into slightly more serious mental illnesses, bipolar disorder, which is unfortunately something I see very, very frequently, and I see it very, very frequently undiagnosed. And I can get more into the reason why I see it undiagnosed so frequently. There are different forms of bipolar disorder. The basics of bipolar disorder are that there is depression, as we had discussed earlier, but then in contrast to that, there are also periods of time that are sort of the opposite of depression, that we refer to as mania or hypomania. During periods of mania or hypomania, a person will spend money excessively. They'll spend money that they don't have. In more extreme situations, you'll see people taking out huge lines of credit to gamble, or spending money that they don't have. People will stay up for a couple of days at a time because they have so much energy, they just have absolutely no interest in sleeping. They have an increase in goal-directed behavior. Just to give an extreme example, there was a patient that I had one time that wrote their life story on 6 rolls of toilet paper. That is an increase in goal-directed behavior. Also, what is extremely damaging about bipolar disorder is that when people are manic or hypomanic, hypomania is like a mini version of mania. People tend to engage in very risky behavior. So that can mean trying drugs that they normally wouldn't try, getting in fights, doing things that would get them arrested, being promiscuous, even if they're married or in a committed relationship. So having bipolar disorder can get you, it can really destroy lives. Bipolar 1 disorder, the mania is more severe than the depression. Bipolar 2 disorder, the depression is more severe than the mania. Cyclothymic disorder, they're both relatively mild versions of depression and mania. They're called dysthymia and hypomania. Getting deeper into more severe mental illnesses, which again, unfortunately, we do see. Psychotic disorders and schizophrenia. Now, by definition, what psychosis is a detachment from reality. So you essentially, to an extent, are not living in the same world as other people. There is something that's ripping you away from what real life is, okay? It's marked by, more often, delusions and hallucinations. A delusion is a belief that someone has that is just completely unrealistic, okay? So, in other words, a person might believe that their thoughts are being transmitted over television to people across the country, okay? To differentiate that, a hallucination means that a person is actually seeing or hearing something that is not there, okay? So much more frequently with psychiatric illnesses, a hallucination will be an auditory hallucination. So a person will hear a voice that's not there, a voice that tells them that they are someone great. I'm sure you guys have all seen movies where a person thinks that they are God or that they have some special powers. It's more so in neurogenic disorders, different forms of dementias, that people have visual hallucinations. It's more common. There are exceptions to every rule. Now, here's what's important for us as people who work with high school and college athletes, is that these illnesses tend to onset between the age of 18 and 31, okay? So you have a student, and in order for them to sort of express themselves, in order for a person to develop and actually have schizophrenia, there needs to be some kind of a biological predisposition towards it. And then usually something stressful happens in order to make that biological predisposition express itself. So one of these that's very, very common, one stress that's very, very common, is shipping off 2,500 miles away to college where you don't know anybody, being away from your parents for the first time, being under the stress of having a really intense coach who yells at you a lot. Those are really solid stressors that can cause a person with a predisposition towards a psychotic disorder to express themselves. Just one other note on schizophrenia is there's another type of schizophrenia, which is more so, It's less marked by delusions and hallucinations. It's more marked by catatonia and flat affect, which if you see a person with a more catatonic schizophrenia, they basically just don't move. They just sit there and can't move. They have no expression. It tends to be more treatment resistant than schizophrenia, but psychotic disorders are very, very complex and respond very, very differently to different kinds of medications. How am I doing on time so far? Is anyone able to? I'm not sure I can hear anyone. How am I doing on time? Am I okay?
Yeah, we have about 13 minutes left until 7 o'clock.
And so, is that when I'm taking questions at 7 o'clock?
Well, if we can take questions maybe at 6:55.
Okay, I'm gonna try to get through the rest of these then. Okay. Returning to play. The most important component of this is that athletics departments are very, very into protocols, which is a great thing. With psychological problems, it's important to have protocols, but at the same time, no two student athletes with depression, with severe depression, will look exactly the same. So it's going to be really, really important to be able to be flexible with return to play protocols. In an ideal situation, the research has shown consistently over and over and over again that people with psychological problems do better if they can receive their treatment on the fly and continue to do all of the things that they should be doing. In other words, going to practice and going to class and keeping up with schoolwork as best they can and sort of suffer through those things while they're getting help. People tend to get faster, a lot better when they're able to do those things. Sometimes it's just not possible. If the depression or the anxiety is so severe that the person cannot continue to function the way that they have been, then they can be removed from their sport. They can be hospitalized. They can be sent home so that their parents can keep an eye on them. But again, keeping busy is really, really important for mental health. Okay. It's important for student athletes to know that if they have a mental health problem, leaving their sport does not mean that they're never going to get to play it again and that their spot is going to be taken and, that everything is over for them from there. They should be given a return to play program, but it should be made collaboratively. It shouldn't be dictated to the student athlete. Modified practice in order to provide for reconditioning. But again, this is only in the case that a student athlete has to be removed from the sport and to be hospitalized or to be brought home. Reconditioning is really, really important. There need to be accommodations because, as I said before, their days are so packed in. One of my biggest challenges is finding times when student athletes can come to meet me when they're not having to be in practice or having to be in their meeting with their academic advisor. So modified schedule tends to be a part of all of this, a part of the return to play program so that they can continue to get care. The team psychologist, I work very closely with our head team physician in order to discuss return to play. Creating a hard program, again, is just something I really encourage people to leave some flexibility in whatever protocol they make. Everything should be confidential, so it's going to be really important for you as athletic trainers in order to maintain the trust of your student athletes, just that you don't say or do anything that your student athlete wouldn't want you to do. I know that you don't have quite the same requirement for confidentiality that a psychologist might have, but in my experience, athletic trainers have been great with that anyways. Student athletes are very, very different in terms of what they want when they return to play. Sometimes they just want to be treated like everyone else. In fact, I'd say that more often than not, in my experience, that's what they do want, is they just want to be treated like everybody else and pretend like life is normal. Sometimes they do want to discuss it with their teammates. So that's, again, another place where we really want to keep things open and be flexible with our policies. if teammates are brought into the equation, they should be allowed to meet with the team psychologist just to discuss issues that they're going through, just to discuss what they can do to help the student athlete return to play. Again, much more often than not, in my experience, what student athletes want is just to be treated like everybody else, and to just kind of have life go on once they're feeling better. So with that, I guess I will wrap up and take questions. Hi, okay.
All right, yes, so we have a couple questions coming in here. The first one comes from Jody, and she's asking, what are your thoughts on proactive team or group interventions?
Sure, great question, really good. Okay, so team interventions are great. I think it's important and it's good for psychologists to give talks to teams as a whole, to educate them on things like anxiety and depression and how to sort of recognize when things might be going wrong for you. Mental health in general, a stitch in time saves nine. So if a person starts to notice that they're starting to feel depressed, if they can get treatment right away, things tend to get better a lot easier than if they allow themselves to get really severely depressed, and then kind of need to pull themselves and need help to be pulled out of it. So I think that education is crucial. In terms of creating, an anxiety group for an athletics department, it's a little bit trickier just because, as I'm sure you all know, so say for example, you're at a university that has 3,000 students or 30,000 students or 50,000 students, there's a relative degree of anonymity. So if the counseling center has an anxiety group, most students can go there and feel pretty comfortable that they're not going to be bumping into somebody that they're going to be embarrassed, that they don't want to know that they have anxiety problems. In an athletics department that has 200 or 500 or 1,000 people, it's much, much harder to do. So student athletes, that's one area where student athletes, in my experience, tend to be a little bit less excited about going to that sort of a group, just because you show up and then everybody that's there, you know them because they're in your department, and now they all know, and they're not going to want to discuss their anxiety in front of people that they know and then have rumors start to spread about them. So that's really my take and has been my experience on groups, but psychoeducation is really, really important for athletics departments.
Okay, there's another question about discussions that you might have with freshmen in general, particularly regarding coping skills during that transition to college.
Sure. Yeah. I think for me, the most important thing is just for them to, I know that almost every athletics department does this anyways, is to be made very, very aware of what the resources that are available to them, right? I think it's less about, teaching them coping skills is important. But what I would focus more so on is, as an athletic trainer, is establishing a relationship with each and every one of them individually as best you can. I know you guys are worked to death. I know. I see it every day. But I think what's more important is that you establish a relationship with them so that they feel like if they are struggling, that they can come to you. Coping skills are important, and psychoeducation is important, and recognizing if you're having psychological problems before they get really bad is really important. And it's good to have all of those talks with them, but there's nothing as valuable as feeling like there's this person, there's like this guardian angel that's like tracking you everywhere you go, that that if you're struggling, you can just be like, oh, they're right there. Let me grab them and be like, hey, this is what's going on. In my experience with student athletes, that is by far the most valuable thing in terms of helping them be able to deal with problems that come up.
Okay. So this question is about what recommendations do you have on how to help student athletes who are currently in isolation and quarantined related to COVID? How do you help them to manage their mental wellness?
Awesome question. Thank you so much for that. When I look at the overall mental health of a student athlete, I very frequently ask myself about three things. Okay, so the first is academics. How are they doing academically? The second is how are they doing socially? The third is how are they doing athletically? If I hear that an athlete is not performing up to their potential on the field or on the court, okay, so now I have an antenna up. If they're not performing up to their potential academically, okay, I have another antenna up. But the one thing that cannot go is the social interaction. The three biggest predictors of depression are past episodes of depression is number one. That's the best predictor of future depression. If a person has one episode of depression, they have a 50% chance of having another one in their lifetime. If they have a second, they have a 70% chance. If they have a third, they have a 90% chance. And if they have a fourth, then it's almost a sure thing if they do not get treatment. Okay, so past episodes of depression, chronic pain, and social isolation. So that means that while they are in isolation, it's very important that they interact as much as is humanly possible on FaceTime with their friends, with their family, that they feel supported, that they're communicating with the outside world, and that they don't feel like they're living in a 20 by 10 dorm room alone, on this planet by themselves, that they don't feel like they're no longer a part of the team. So coaches have to check in on them constantly. Athletic trainers have to check in on them constantly. The one component there, again, of depression that we can really control is the social isolation. So that is the most important thing for student athletes when they get quarantined. People just have to stay on top of them, and they need to stay on top of interacting with other people as best they can.
Awesome. This is from, I believe his name is pronounced Yuwa, but a follow-up question that was posted from him is, what are some resources for departments that aren't able to have a full-time sports psychologist on staff?
Okay, so most cities, okay, let me take a step back. It depends on the level of issue that you're dealing with. So for example, we in Palm Beach County have a clinic here that has an inpatient psychiatric unit for indigent people. They also offer low-cost services for people that just can't afford therapy or can't afford to go see someone to have medication prescribed. The overwhelming majority of places are going to have some form of that kind of a system within shouting distance of where a university is, even in rural areas. Most times there is a place within so many miles of where a university is. Or where a high school is, so that there should be some kind of a resource, even if it's a little bit of a drive. If there's not, there are telepsychology services, similar telepsychology services that are available, but it's different from state to state, because theoretically a psychologist is not supposed to practice psychology across state lines unless they also have a license in the other state. So in other words, if I'm talking to someone from Alabama, I need to have a license in Alabama, or I need to know that Alabama's licensing laws are lenient. So the most important thing is to go through your local resources, go to government websites and figure out what that is. We have one basically in every county here in South Florida. We have South County Mental Health Center here in Palm Beach County. There's the Henderson Clinic in Broward County. So, and again, a lot of these places they're not the best care around, but they are care. So that's my best advice for people that can't afford outside or inside help. And beyond that, a good place to start is always going to be your primary care physician or head team physician. That's always going to be a good place to start.
All right. Yes, absolutely. And we have quite a few other questions here. If we want to maybe kind of rapid fire them, there is one. Joe also asked about any specific things that they could or should discuss with seniors as they're transitioning out of athletics?
Yeah.
And then there's a question from Michael about different approaches for team-based sports and athletes versus individual sport athletes when you're approaching mental illness and issues.
Yeah. A lot of issues within human behavior, within psychology, are consistent, right? So in other words, if a person is suffering from severe depression, there's a really good chance that they've thought about hurting themselves. That's something that unfortunately we see, not everybody, but unfortunately more often than not in my experience. Then there's a lot of, then unfortunately most things though just depend on the scenario, right? So a lot of the questions you're asking are awesome questions, but they'll really be dependent on the specific student athlete that you're talking about. So some student athletes have no problems transitioning. Some student athletes are going to have problems transitioning, not because they don't know what path they're on, not because they don't have social support, but really just because for whatever reason, it could be anything. It could be that they're not used to cooking and doing their own laundry or whatever it is. I mean, there's just such a broad range of issues that make it difficult, in my experience, for student athletes to transition from college life to post-college life, that I'd really take that on a case-by-case basis. Just because if there's one thing that college students really don't like, it's being given help that they don't want, right? So in other words, if you're educating them on how to transition the proper way and they're like, that doesn't help, right? You're addressing all the wrong issues. That's really an issue that, I would say you take on a case-by-case basis and speak to the actual issue that they're dealing with so that a person feels like their needs are being met. Because all of you have been to college and have been through that, this is the sort of thing I always say, like when I talk to student athletes as a whole, I always say your athletic trainers have broad shoulders, right? Like you can rely on them. They have life experience. They've been through school. They've been through what you're going through in terms of transitioning from college. Those are areas where I see athletic trainers doing an awesome job because you have that life experience, because you've been through it, and helping and seeing, okay, this is the issue that they're dealing with. You just talk it through with them. Obviously, if it reaches the point where they're suffering from depression, then you want to send them to a mental health professional. Second question was
the approach a team sport versus an individual sport, and the student athlete is dealing with mental illness.
Sure.
Do you approach those differently?
Sure. And the answer again, on what I would say, it just depends. There are teams that I've had where, like a golf team, for example, where it's an individual sport, but they're super closely knit. And then there have been other ones where it's 9 golfers in 9 separate cabs. So just depending on, team dynamics, they should matter always, but in sports like golf, sometimes they kind of don't. Sometimes golf teams don't have a lot of cohesion. They don't hate each other, but they don't have a lot of cohesion, but they perform off the charts great. So I think that if you're dealing with mental health problem in a cohesive team, a team sport or an individual sport where the team unit is close, you really want to, if they're open to it, you want to incorporate the teammates into helping that person get better. You want to encourage that person to seek out social interaction from their teammates, because all they want to do is get in bed and pull the covers over their head. Well, I know it feels awful, but if all of your friends are going out to Chipotle on Friday night, and I know it's the last thing you want to do, I need you to go out with them, because that's what you normally would do, and you're going to get better a lot faster if you continue to interact with your teammates. So I guess I guess what I'd say is it depends a little bit less on whether it's an individual sport or a team sport, and more about how cohesive the team is, and if the team dynamic is one where that team can be a resource for you to have them help pull that person out of their bed and into the real world.
And then I wanted to end on this last question, which I think is a really good one, coming from Rashonda. And they're asking, okay, for these athletic trainers, you're dealing with adults who are in college. What type of intervention is necessary or allowed by either their parents or the athletic trainers?
Sure. So they are, unless they come to college and they're freshmen, they're 17 years old, they're grown-ups. Their parents have no right. I mean, and look, I'm speaking legally and ethically. Their parents have no right to tell them that they can't take an antidepressant. They just have no right to do that. They can't, because that person is a grown-up. They have no right to stand in their way of doing that if what both the student athlete and the doctor thinks is what's best for the person is to take an antidepressant. My approach on that end is to provide education to a person who's suffering from mental illness and to allow them to make their own decisions, right? Because again, they're grown-ups. I want to give them the power to make their own decisions. More often than not, they'll say, what do you think I should do? And I'll give them my opinion. So let's go again with the example. Of course, I'm of the opinion that people should not be on medication unless they need to be on medication. But again, let's go with the example of antidepressant medication. I will provide them with education on antidepressant medication. And then they'll say, what do you think I should do? And I'll say, in my opinion, I think it would be good for you to go on the medication. However, if you really don't want to, I'm behind you. And if you do want to, I'm behind you, and we'll figure it out and we'll get through it, whether you're on the medication or not. In my opinion, I think it would be a good idea. But if you decide no, we'll come at it a different way. And that's sort of it, you know? So I just try to leave the power in their hands as much as I can.
And then maybe what about reporting wise, if someone comes to you and says they want to hurt themselves, as if they're coming to the athletic trainer and the athletic trainer says, okay, I don't have resources, what?
Right. So if you don't have a team psychologist to fall back on, and you have a student athlete that said they're going to hurt themselves, you do just have to call the police at that point, unfortunately. You know, a lot of times if you get a skilled psychologist, they can really get to the root of the problem, see if the person really is suicidal. But, you know, unless you have years and years of training, my recommendation would be that you don't try to kind of parse out something that can be so complicated. If a person says they're going to hurt themselves, you need to call 911.
Awesome. Well, thank you so much for your time. Thank you for working with all of the technological situations we had come up tonight. I do appreciate it. Thank you everyone who is attending here, and look forward to seeing you at the next one.
Thank you.